The 5 rights of medicine administration. To ensure that you are following the key guidance in the NMC Medicine Management Standards, you may want to consider using the 5 rights of medicine administration to keep you on the right track. Number 1. You have the right patient. This involves ensuring you have done an ID check, both at the start of the station and just before the medication is administered. Number 2. You have the right medication. This means you have checked the medication administration record and ensured not only that you have selected the correct drug, but you have ensured the drug is appropriate for the patient based on its compatibility with other drugs the patient may be taking, the action of the drug, the labeling on the bottle including the expiry date, and the patient's current condition. For some drugs, you may want to know the patient's current observations, and your examiner will be able to tell you. Number 3. You have the right dose. To ensure that you are administering the correct amount of the drug to the patient, you can either base this on your prior knowledge of prescribing this drug, or you can look it up in the BNF. Remember that the weight of the patient could impact how much dose is given. For example, if a patient was under 50 kilograms, you would not administer the standard dose of paracetamol. Number 4. You have the right route. The route could be oral, IV, injection, suppository, but in the OSCE exam it is always oral. Number 5. You have the right time. This means that before administering the drug, you should check the date, time, and frequency the drug should be administered. However, there are another couple of things to remember in addition to these rights. You can remember these as doctor or DR. Documentation. Documentation must be correct. You must sign or code correctly for any medications you give or withhold, and the prescription should be signed to ensure it is valid. Reaction. Think about reactions or allergies to any drugs that mean the drug should not be administered.